Hi, this is Doc Parsley talking to you today about the association between menopause and sleep. Over the years, I've had a lot of questions about this. And unfortunately, the two are related. And I say unfortunately because menopause, by and large, what people mean by menopause is they're talking about the symptoms of menopause. And the number one symptom that is complained about, or the one that's complained about the most, with the most intensity, I should say, are the hot flashes. And what the hot flashes are is it's caused by something called a luteal surge. So you have a region of your brain called the pituitary that stimulates ovaries to produce more estrogen. And the molecule that comes out of the pituitary is called luteinizing hormone. And so when estrogen is really high, your hormones are regulated during sleep. So when estrogen is really low, the brain senses that it's really low and it tries to secrete a lot of luteinizing hormone to make your ovaries produce more estrogen. Unfortunately, that rush of luteinizing hormone also causes the hot flashes. It causes almost like a physiologic stress that causes that symptoms of what's known as hot flashes. So during the day, hot flashes occur, of course, but they don't seem to be as problematic. If anything, they're just most often just complained of as being embarrassing. But at night, they disrupt your sleep. Unfortunately, all your hormones are reset while you sleep. So your best chance of having the most normal level of hormones is getting a good night's sleep. But of course, if you have really bad hot flashes, that's preventing you from getting sleep, which is then making your hot flashes worse, which then makes you feel worse during the day. Unfortunately, besides getting a good night's sleep, the only thing that really works completely to remove the symptoms of menopause is hormones. I mean, it's a hormonal problem, right? Your hormones decrease as you get older, both men and women. That leads to symptoms. The only thing we know for sure that gets rid of all those symptoms is to replace the hormones. Understandably, a lot of women don't want to take hormones. There are some supplements that you can take. DIM is meant to help, from what I hear. Magnesium helps. Vitamin D3 helps. Anything that sort of decreases your stress hormones will help, just because that's one of the benefits of getting good sleep, and it's one of the things that will allow you to sleep better. Our sleep product actually has both magnesium and vitamin D3 in it. Not intentional. That's used in your brain to make melatonin as well. So there's potential. There's some help there. Again, the other things that you can do is anything that decreases your stress. So decreasing your stress through meditation or yoga, mindfulness training, walking in nature, aromatherapy has some really interesting principles in it. When you take scents into your nose, or when you smell things, it goes through a different region of your brain. It doesn't have to go through the central processing area of your brain to be interpreted. That's a sense that just goes directly to the brain and can activate various regions. And certain calming aromas. Lavender is the one I know of being the most powerful. Can actually decrease stress hormones. It decreases anxiety, improves cognition and mood, and all this other stuff. But it has been shown to decrease hot flashes, both the intensity of them and the frequency of them. I'm not exactly sure how it works. Nobody knows that yet, but it has been proven to work. So if you're experiencing hot flashes, the good news is they are going to go away eventually. The bad news is that they're going to go away whenever they're going to go away, and if you don't want to do hormone replacement therapy, the other things, the magnesium and the vitamin D3 and the DIM and the aromatherapy, those will help, but they won't completely get rid of the symptoms. It'll just ameliorate them or decrease them. So hopefully that's helpful. If you're experiencing those, I sincerely feel sorry for you. I wish I had better news for you, but not, all's not lost. There is some improvement to be had, and make sure you get good sleep first and foremost. Thanks.